The following portion of Daytime is sponsored by the Jasin Facial Rejuvenation Institute. Well, when you look in the mirror, do you recognize the person who's looking back? Have you ever had people ask you why you're angry or tired when really you're neither? No amount of cream or makeup can make your eyes look fresh. Droopy lids and bags under the eyes can be fixed in an afternoon. And here to tell us how is the face doctor, Michael Jasin. Good to have you here.
Thank you.
So yes, droopy lids. The worst thing for people who feel like they've had a good sleep is to have somebody come over to them and say, "You tired? What's the matter?"
Yeah, it's really interesting how the eyes portray a message to others and how we're perceived. And when the eyes get droopy due to excess skin hanging over the eyelid crease, it does make you look tired. Sometimes people think it makes you look mad when you're not mad, or you're sad when you're not sad. So it's all a perception thing, but the eyes are very key to how people think we are feeling and acting.
You're right about that. We've got some photos to take a look at. Just to give you an example, and well, I'm sure a lot of people at home can relate to this. Beautiful woman, but she's got droopy eyes.
Right, we've got a few different scenarios here, different levels of hooding of the upper eyelids. This is a 40-ish patient who had the hooding of the upper eyelids to a moderate degree, both the upper and, right and left. And now we get to a little bit older patient who's got more advanced hooding of the upper eyelids, more skin folding over, it's touching the lashes. And then the next one will show a more mature patient before and after. You can see below her post-surgical result, but look at all the hooding she had due to her advanced age. And some of this is genetic, but it tends to always get worse as we get older.
And how did you do that? Your procedure is quite different from others, right?
Well, it is. Blepharoplasty is the term used for the surgery that we do in the upper lids. It involves making an incision in the upper eyelid crease, and the excess skin is removed, usually along with some bulging fat that's obscuring the eyelid crease. The difference in what we do is I use a laser versus a scalpel, so it makes the procedure pretty much bloodless.
Good.
It makes it go faster. It helps ease recovery because usually there's less bruising and swelling due to the fact that there's less bleeding during the procedure.
And probably no scar at all that anybody would be able to notice.
Well, it falls in the crease of forms when you open your eye, so it's very well camouflaged.
Wonderful. Okay, now a lot of people have eyebrows that are just low. Like this woman, for instance.
Right. And for some people, it can be actually even more eyebrow than it is eyelid, or it's a combination of both, as it is in this patient. So you can see how the low-set brow causes accentuation of the hooding of the upper eyelid.
Right, and it can make you look angry when you're not. There's another example of it right there.
So in these cases, we usually will suggest doing something to the brow to get the brow in a higher position, which will get the eyelid looking more open and a brighter look.
Right.
There are various ways to do that, some involving scalp incisions, but one minimally invasive way that we usually recommend patients consider is called a brow pexy. And basically what we do is go through the upper lid incision we've already made, and we come underneath the brow, free it up, and tack it up with 2 sutures. And so we've gotten the brow in a better position, but there's no added recovery because we're going through the same incision we made for the eyelid anyway.
Very nice. Okay, we have another photo to take a look at. I think, oh boy.
This is an example of what blepharoplasty can do for a patient for upper and lower eyelids. This takes about 30 minutes to do an upper lid procedure, about 30 minutes to do a lower lid procedure. It's done in the office, and the office is fully accredited for office surgery.
Wonderful. And this is laser resurfacing. Yeah,
this is an example of what we can do sometimes without making any incisions at all. The patient did have some excess skin in the upper eyelid, but just by doing a laser resurfacing, you can see that it looks like she had a blepharoplasty basically, but no incision was made.
My goodness. Now baggy under the eyes. A lot of people have this issue.
Again, this is something that can be genetic, but tends to get worse as we get older. Makes people look tired, look worn out, and especially for people that are getting back into the workforce these days in this economy. You got puffy lower lids and you look tired, you don't look like as good a candidate as you might be otherwise.
Right. And concealer does not conceal that.
No, it doesn't. So for this, we do a procedure called lower lid blepharoplasty, where we remove excess fat out of the eyelid, usually with an external incision. The technique I like to use is with an internal incision, so there's no scar. Again, we use a laser, so it's pretty bloodless.
Wonderful.
And there's no external incision at all.
And this was done with filler.
This is done with filler to fill what we call the tear trough, which is the crease below the eyelid. And by filling that tear trough, it makes it look like the bags have gone away. So basically camouflaged it, but using a non-surgical alternative.
My gosh, a lot of alternatives out there. Very good. All right, Dr. Michael Jasin of the Jasin Facial Rejuvenation Institute, thank you so much. To get your questions answered or to schedule a consultation with Dr. Jasin, call 813-975-3223 or log on to jasonfacial.com. Don't go away. Daytime will be right back. The preceding portion of Daytime was sponsored by the Jasin Facial Rejuvenation Institute.